advised this public meeting of the Washington County Commissioners audio and video live stream on the Commissioners YouTube channel. As we do in every meeting, we start with a prayer. Today's prayer is to be offered by Bill West. Mr. West.
Well, good morning, everyone. It is a wonderful thing that we live in a county where we can pray before we do business. So let's just go before the Lord today. Father, I just thank you, Lord. I thank you, first of all, for every person in this room and every family represented by each of these individuals. Father, we are 1 week away from Thanksgiving. And I want to thank you, Lord, for the county that we live in, for the government you've given us, the fact that we can live in peace and harmony. And Lord, I pray now that your presence would be invited into this room. No matter what happens today or what business needs to be taken care of, that you would be the final arbiter of what happens here. So Lord, I just pray right now, Father, that Washington County be a blessed county. Father, I pray that Washington County be a place where people would desire to live and want to live because of the peace and harmony and goodwill that you have established here. Father, and I also pray that the destiny that you've called this county to would be made manifest in our lifetime, Lord, that we would see what you have for us and we would live in a new way, in a new fashion, that we would also be able to give you glory for everything that happens. So, Father, I pray right now that this meeting be yours, and I pray it in the mighty and powerful name of Jesus. Amen.
Amen. Our Veteran Director, Mike Pierce, will lead us in our Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Mike.
This time I'll entertain approval minutes number 1218, dated November 6th, 2025.
So moved.
Second.
Roll call, please.
Mr. Maggi?
Yes.
Ms. Janice?
Yes.
Mr. Sherman?
Yes. There is no special order of business today, which is good because we have a lot of agenda comments today, so we're going to just jump right into that. The agenda comments, the views and opinions expressed by the speakers during the public comment are exclusively those of the speakers and do not reflect those of Washington County Board of Commissioners and have not been verified. Our first speaker for the agenda comment is the Cheryl Andrews.
I'm Cheryl Andrews, Executive Director for the Washington Drug and Alcohol Commission, which serves as the single county authority for Washington County. I am respectfully requesting that the Commissioners vote no to the agenda item letter N under new business, letter of intent, human services. In 2001, Washington and Greene counties partnered to deliver human services together as a joint single county authority. Greene County's Commissioners voted to end the partnership. Recognizing the limited capacity to effectively serve Washington County's drug and alcohol-related needs, Washington County Commissioners voted to relinquish their right to serve as the single county authority. The Board of Commissioners at that time turned the matter over to the state, who requested proposals to determine who would best be equipped to serve the county's needs. As a result, the group of individuals that were displaced by the county became incorporated as Washington Drug and Alcohol Commission, achieved a nonprofit 501c3 status, and was awarded the contract to serve as the SCA. Washington Drug and Alcohol Commission has decades of strong outcomes and community trust. This takeover is not about improving the system of care. It is only about power and control. Commissioner Sherman mentioned at the agenda meeting that the Hill Group study is the basis for the takeover. This study doesn't say that the SCA would serve the public better under the county umbrella. Instead, it calls for a greater cooperation and partnership, something WDAC has also requested and sought after for years. Instead, if you vote yes, you're going directly against the recommendation and further harming the relationship and existing services. In my 14-year tenure with WDAC, I have never had any issues with the Board of Commissioners or the Department of Human Services. All this changed with the most newly elected commissioners. As commissioners, you are inherent leaders of the county, leaders that need to do the right thing, work with existing organizations that are supporting residents, not against them. This infighting creates unnecessary distractions and hinders us from doing the work that is so vital. The drug and alcohol system is not broken. In fact, the Hill Group study directly highlights that many areas of strengths within the system, which are a result of WDAC's consistent coordination, strategy, and care. Don't reinvent the wheel. Instead, let's talk reconciliation to reduce duplication and unlock opportunities for coordinated planning and funding. Together, we can have the greatest impact in the lives of the residents of Washington County. I respectfully request you vote no to agenda item letter N. Thank you.
Hey, Cheryl, we don't normally have question and answer, and I know the chairman has taken some liberty to doing it. So, are you getting any opioid money?
No, sir.
The last 3 years, you haven't gotten it?
No.
Have you requested it?
Yes.
Thank you.
Next speaker is David Rowe, Mayor.
Mr. Chairman, Commissioner-elect Jones, Commissioner Maggi, thank you for the opportunity to speak this morning before you folks and all these folks in the audience. Good morning. I am David Rome, and I am here today not only as an elected official, but as an active member of the Washington County Opioid Overdose Coalition. I attend these coalition meetings regularly, and I can say with absolute confidence that the work happening in this county is strong, coordinated, and is saving lives. Much of the progress has been possible because of the partnership and leadership of the Washington Drug and Alcohol Commission. For over 20 years, Cheryl Andrews and her team have been able to table for every major conversation about prevention, treatment, recovery, and community safety. Their consistency and the depth of expertise are why many of the initiatives have moved forward with clarity and purpose. I also wanted to recognize the late District Attorney Gene Battone, who served as the original co-chair for the coalition. Gene's passion for this work was unmatched. He believed deeply in collaboration, in evidence-based practice, and in building a system that treated substance and use disorder as a public health issue that it is. Gene worked hard and worked hand in hand with WDAC to lay the foundation we all stand on today and to create a county-wide strategic plan that has been guiding drug and alcohol-related efforts in the county for years. Our coalition includes law enforcement, schools, EMS, hospitals, community leaders, and everyday residents. And in every meeting, one thing is clear. WDAC has been the steady partner that keeps the system connected, coordinated, and focused on the people who need us most. We are making real progress in Washington County, and I see it firsthand. Now is not the moment to disrupt what is working. Stability matters, expertise matters, and the partnerships that we have made. For the sake of the families we serve, the lives we hope to save, and the legacy of leaders like Gene Battone, I respectfully ask your support for WDAC as a single county authority and ensure the opioid settlement funds are stewarded through the structure that is already delivering results here in Washington County. Thank you, and God bless the United States of America.
Good morning. My name is Tammy Taylor, and I serve as the Prevention Supervisor at the Washington Drug and Alcohol Commission, and I speak to you today with 26 years of experience at WDAC. When I began my career here in 1999, the Commission operated under the Washington County Human Services umbrella. At that time, I saw firsthand the layers of bureaucracy that limited our ability to deliver substance use disorder services effectively. Essential services that residents urgently needed were often delayed or constrained by county processes that were never designated for specialized client-centered care. Under county oversight, securing funding for critical programs required months of waiting for purchase orders to move through the controller's office and then through the commissioner's approval. Hiring vital staff was slowed dramatically by the civil service system, leaving positions vacant and delaying care for individuals facing urgent or life-threatening situations. These structural barriers meant that people waited far too long for services that should have been readily available. In 2001, the county commissioners determined that the required 10% match for SUD services was too great a burden for taxpayers and sought an outside entity to assume responsibility for the commission. This led in 2002 to the decision, supported by our then director and legal counsel, to work with the state and establish the commission as its own independent 501c3. Since transitioning to a nonprofit structure, WDAC has been able to operate with a level of efficiency, flexibility, and responsiveness that was simply not possible within county government. Independence allows us to tailor services to the real needs of the people that we serve, to respond quickly to emerging issues, and to manage resources based on clinical priorities rather than administrative bottlenecks. Funding can now be deployed swiftly where it is needed most. Staffing decisions can be made in real time, and care can be coordinated in a way that truly supports recovery. Today, WDAC provides more streamlined, person-centered, and accessible services than ever before. Our independence has strengthened our ability to deliver high-quality, compassionate, and efficient care to the residents of Washington County. For these reasons, I respectfully urge you not to return the services to a county structure that has already shown it can delay care, slow staffing, restrict access. Instead, I ask that you keep WDAC as an independent, single county authority so we can continue delivering the timely, effective, and life-saving substance use disorder services that our community greatly depends on. Thank you.
Tammy A.C. Rowland.
Good morning. My name is A.C. Rowland, and I'm here as a community member who deeply cares about what happens to Washington Drug and Alcohol Commission, and more importantly, to the people it serves. For years, WDAC has been the heart of recovery efforts in our county. They show up for people when everyone else has turned them away. They stay committed when funding was tight, when the work was hard, and when the stigma around addiction made that work even harder. This is not an organization that needs saving. It's one that's been saving lives for decades. That's why the sudden move by the county commissioners feels so alarming. It was only a short time ago that the commissioners said they had no plans to intervene. And now, without any warning or public conversation, we're here talking about a complete takeover. To many of us, this doesn't look like support. It looks like you're taking control. If the goal is to truly improve care, then why not bring WDAC to the discussion instead of sidelining them? Why not release the taxpayer-funded reports on substances use services so the public can see for themselves what's working and what's not? Why the rush? The people whose lives depend on these services deserve transparency. They deserve stability, and they deserve respect. This opioid settlement funds were meant to heal communities, not divide them. They were meant to repair harm, not create new wounds. The decisions made here today will shape how we respond to addictions for years to come. Let's make sure those decisions are guided by compassion, by evidence, and by the people who have dedicated their lives to this work. So today I ask you to slow this process down. Vote no on N. Listen to the experts at WDAC. Bring them to the conversation. Let's protect the system that's already changing lives instead of dismantling it for political convenience. Every person who finds recovery through WDAC is proof that the approach works. Let's not undo that progress. Let's choose a partnership over your power grab. Thank you.
Having sense, give it to me, please. Sunsky, thank you.
Good morning. My name is Heaven Sensky-Kirsch, and I'm the organizing director at the Center for Coalfield Justice, and I live here in Washington County. I want to start by naming what too often goes unsaid. The Washington Drug and Alcohol Commission has spent decades doing life-saving work with almost no resources, no spotlight, and no real safety net. They showed up for our neighbors when no one else did. They built trust in our communities, where trust must be earned, not assumed. Their outcomes are strong because they have never stopped fighting for people who have been written off or ignored by systems that claim to serve them. And now, after the county relinquished authority years ago, opiate settlement money appears, and the county wants to take over. Let's be honest, this is not a plan to improve care. This rushed decision is dangerous. It did not include stakeholders from WDAC or the recovery community that they have served for 20 years. And we cannot ignore the impact of criminal legal entanglement. When the county, deeply connected to law enforcement, takes over these services, many people will avoid seeking treatment out of fear of punishment, surveillance, or being judged. That fear is real, and it will absolutely push people away from care. At the Center for Coalfield Justice, our mission is grounded in fighting for intersectional justice because we believe the harms our community faces are interconnected. Pollution, poverty, lack of access to healthcare, and the opioid crisis do not exist in separate silos. The same communities that were targeted by pharmaceutical companies, the same communities exploited and lied to as pills flooded our towns, are the communities now being put at risk, again by rushed political decisions over money that is sent here because of overdose deaths. People in Washington County have been harmed enough. They deserve stability, transparency, and care, not another upheaval carried out behind closed doors. I'm asking the commissioners to do what responsible leadership requires. Slow this process down, vote no on N item, and bring WDAC and their supporters and the families that have been impacted by the care that they provide to the table to discuss how to actually serve these communities. This settlement money must reduce harm, not create new harm. And alienating WDAC instead of working with them is doing the opposite. We should be supporting them, not undermining the agency. Thank you.
Bethany, thank you.
I'm here today because my former employer, WDAC is facing a crisis, not because of money, workplace strife, or a new surprise drug trend on the street. They are facing a crisis because of this board. I spent almost 13 years of my life on the third floor of what I still call the Millcraft building. Only my last few years there were clouded over with the idea of being reabsorbed by Washington County. You see, there has been a level of integrity both in practice and principle with WDAC being independent. There are no side hustles, there are no backdoor deals, and there's never any profiteering for any one person. Because of their policy on conflicts of interest. Simply put, WDAC is based on getting people into the treatment and care that they so desperately need and deserve with respect and timeliness. Over my 13 years, I witnessed programs flourishing. I don't want to rehash everything that has been said already. You all are all aware of the programs that they do. I know you may ask, if it was so amazing, why did you leave? The main reason why I left was because I knew this very day was coming. So we've had a term and a half of this fear looming. This is no surprise. This is no shock, at least not to me. You are trying to take something that isn't broken for the purpose of breaking it and then profiting from it. We all have witnessed that as government control over our social services programs broadens, it becomes ineffective, impotent, and bloated. If you reabsorb WDAC now, you will effectively reduce the ability for those who need help to get it. There will be red tape all around while forcing patients to jump through how many hoops? How many people will die while waiting? Are you truly ready to take on that great responsibility? WDAC has been taking on that challenge with effectiveness for 20 plus years. How much money will be diverted to pet projects rather than getting people the help they need? Please don't base your vote on the visions of dollar bill signs that may dance in your dreams at night. Thank you.
I would be remiss if I didn't respond to that. I mean, to have that many people here speaking so passionately, and I can see and feel the tension from everyone here. What we're doing is looking at the results of a study that's been ongoing for 2 years. The results of a lot of people putting a lot of work in to look at how do we best serve people in Washington County that are suffering from substance abuse disorder. This is a big job. I can tell you that this is not the first meeting like this that I've had. This mirrors to me in parallels 2 years ago when we met with UPMC and we were at a lot of the meetings, and every nurse, doctor, and custodial worker there was told that they're going to be losing their jobs and they're going to be out. We now saw a merger come through with UPMC and Washington Hospital, and not a single nurse was displaced, not a single person lost their job. We are looking at this study to see how we can have the best resources for you to give them to the people that need it, period, the end. If this comes through, and we do decide to do this, because no decision is made, right now we're just looking at facts, nobody loses their job. You will most likely not even have your office changed. Because what this is happening is to have more wraparound services through Children Youth Service, through our Veterans Department, and every other department we have where you'll be working with them. I can tell you that you're hitting a panic button that doesn't need to be there, and I can feel it. And I can also tell you that for 20 years, I worked in the nonprofit sector. And I can tell you how many times in Allegheny County, Washington County, or someone else, or a new president judge came along and tried to do some kind of new initiative, and I drove home wondering if I was going to be on the chopping block, and wondering how I was going to feed my children. I understand the stress that you're under because of, but what I can tell you is this is not to get rid of any organization. This is about to increase the capability of treatment for people. Allegheny County has done it. It was a smooth transition, and a lot of the counties have. There's a better way to do this. So that's what this is about, to look at a study and to see if this is a good idea and if it's not. This is going to be 8 months to a study to 6 months in a study. It has to go to DDAP. It has to have state approval. All we're asking is for DDAP to come in and look at this and say, what do you like, A or B? Period, the end. That's what we're voting on today. We're voting on sending this information that we collected that was taxpayer dollars to go in and be sent to the state and say, look at the study that we did. DDAP, what do you think? That's it. No one's losing their job. No one's shutting down Washington County Drug and Alcohol. So again, I could see the stress in a lot of you. Nothing is happening. If this goes through, it wouldn't happen until July, August at the earliest. And again, I think that this could potentially be a great thing to get a lot of treatment, a lot more treatment for people. And not one of you, again, we would need you to come over and work and do the work that you're already doing. We need the experience that you have. So again, I would be remiss, and I only want to say this, that I feel the stress. No one's losing their job. Are we going to do the merger or not? It's going to be up to me.
Mr. Chairman, I was not going to say nothing, but I respectfully disagree with what you just said. We are moving down that line. We looking at the budget, and we're looking at creating positions to take that over. So that's not totally accurate. We're moving down there to take control of it. Now,
Mr. Maggi,
some of those folks, excuse me, sir, whether or not some of those folks you're planning on trying to bring over or not, but we're creating another arm of government. We know how government works. We just see what we went through and to do what these people have done well. So I was not going to say nothing, but I just totally disagree with what you just said. We're moving down that road to take it over.
Mr. Maggi, that is fear mongering.
Divisions that you're creating. I mean,
Larry, you were in the meeting where we talked about that. That's just very disingenuous. You were in the
Not
meetings
true.
that
We
we
were
talked.
talking about creating positions for
We're
this.
talking about creating positions if the merger goes through where all of you would be working for Washington County instead of Washington County Drug and Alcohol.
What's the point?
No, we're done. Thank you.
You're duplicating jobs doing that. You're wasting money. That money's for the people that need it, Sherman.
Just
Got it.
release the
Not-
money.
Again,
not your
20 years I have experience
administration.
in doing this. I
Great.
promise you.
And we still got drug addicts out there, so apparently you're failing.
We're gonna go with the new business. Thank you. Mr. Sweat. All business.
Thank you, Mr. Chairman.
Go ahead.
Addendum, the planning commission respectfully requests the commissioners approve price and technical proposals for the Pipe Number 1 Bridge Replacement Project with the revised scope of work, inclusive of items to complete the final project design, which will increase costs by $333,761.17 for a total project cost of $908,028.06. All costs will be federally funded.
Second.
Roll call, please.
Mr. Maggi?
Yes.
Ms. Janice?
Yes.
Mr. Sherman?
Yes.
Item B, change order. Purchasing on behalf of the planning commission respectfully request the commissioners approve change order number 6 with Fleer Contracting of Cecil, Pennsylvania for additional hand dryers and wiring for the Washington County Fairgrounds Exhibit Hall Number 1 restrooms project at an increased cost of $1,142.06, which will be paid with 2023 local share account grant funds. This change order represents an adjusted overall project cost of $573,387.69 and has been reviewed and recommended for award by the Planning Commission.
So moved.
Second.
Roll call, please.
Mr. Maggi?
Yes.
Ms. Janice?
Yes.
Mr. Sherman?
Item C, purchasing on behalf of Building and Grounds respectfully request the commissioners approve change order numbers 1 and 2 with American Restoration Services of Pittsburgh, Pennsylvania for additional work in the Caldwell Building at an increased cost of $9,500, which will be paid with capital funds. These change orders represent an adjusted overall project cost of $38,000 and have been reviewed and recommended for award by Building and Grounds and the County Administrator. Change order number 1 calls for the removal and replacement of sealant around all windows, stone and ledges at a cost of $5,000. Change order number 2 calls for removal and repainting of metal columns at a cost of $4,500.
So moved.
Second.
Mr. Maggi?
Yes.
Ms. Janice?
Yes.
Mr. Sherman?
Yes.
Item D, bid extension. Pursuant to Act 142, Senate Bill 1154, effective February 20, 2001, purchasing respectfully request the commissioners authorize a 30-day extension of the bid pricing for the 14-unit T hangar for Washington County Airport to erect a tube, Inc. of Harvard, Illinois, as additional time is needed to evaluate the bid responses.
So moved.
Second.
Mr. Maggi?
Yes.
Ms. Janice?
Yes.
Mr. Sherman?
Yes.
Item E, work order. Purchasing respectfully request the commissioners approve a work order in the amount of $73,659 with Remington and Vernick Engineers as part of the county's professional service agreement for engineering services for a miniature golf course at Mingo Creek County Park. Neither construction specifications, bid documents, nor geotechnical investigation are included in this scope and fee.
So moved.
Second. Roll call, please.
Mr. Maggi?
No.
Ms. Janice?
Yes.
Ms. Sherman?
Mr. Chairman, that concludes all business.
Thank you, sir. New business, Chief Clerk.
Commissioners, can you please entertain a motion to revise item P on the agenda? Under new business, to approve an addendum to the lease agreement with the Bentleyville Public Library, not the Roman Catholic Diocese of Pittsburgh.
So moved.
Second.
Roll call, please.
Mr. Maggi? Ms. Janice?
Yes.
Mr. Sherman?
That's the roll call, please.
To change the agenda.
Okay. Because we changed it on the fly, is there anyone that would like to make a public comment about us changing the aging service request of the commissioners to?
Speak up.
Lease agreement for
We
Bentleyville
can't
Public-
hear you.
Microphone wasn't on, my apologies. Is there anyone who would like to make a comment specifically about Agenda P, which is purchasing on behalf of Aging Services respectfully request the commissioners to approve a lease agreement for the Bentleyville Public Library for the Bentleyville Senior Center to increase their monthly rent by $100 effective December 1, 2025, bringing their monthly total up to $850. Initially, it said,
Archdiocese.
initially it said
Catholic Diocese.
it read the Archdiocese was getting the payment, not the senior center. So the payment goes to the senior center. Any public comment? Okay, thank you. New business, please continue.
Chief Clerk, respectfully request the Commissioners approve the appointment of Suzanne Drake to the Southwest Corner Workforce Development Board and the reappointment of Bob Griffin to the SPC Board.
So moved.
Second.
Roll call, please.
Mr. Maggi?
Yes.
Ms. Janice?
Yes.
Mr. Sherman?
Yes.
Chief Clerk, on behalf of the Coroner, respectfully request the Commissioners approve the cost of training and all travel-related fees within the rules of the county's travel policy for a deputy coroner to attend continuing education training on November 17, 2025 in Pittsburgh. The cost will be $100 plus mileage and will be paid via the coroner's operating budget.
So moved.
Second.
Roll call, please.
Mr. Maggi?
Yes.
Ms. Janice?
Yes.
Mr. Sherman?
Yes.
The Planning Commission respectfully request the Commissioners approve a right of entry agreement with EQT for plugging an orphaned well located in Mingo Creek County Park. The access road and well site will be restored upon completion of the work.
So moved.
Second.
Roll call, please.
Mr. Maggi?
Yes.
Ms. Janice?
Yes.
Mr. Sherman?
Yes.
The Planning Commission respectfully requests the Commissioners approve a highway occupancy permit submitted by EQT for access to an orphaned well site in Mingo Creek County Park. The signed forms will allow Mr. Andrew Benchek to act as agent for the county to apply for the permit.
So moved.
Second.
Roll call, please.
Mr. Maggi?
Yes.
Ms. Janice?
Yes.
Mr. Sherman?
Yes.
Children and Youth Services respectfully request the Commissioners approve the recommended agreements for support services for the period of July 1st, 2025 through June 30th of 2026. The total contract authorization amount is $2,400,240, and no additional county funds are required.
So moved.
Second.
Roll call, please.
Mr. Maggi?
Yes.
Ms. Janice?
Yes.
Mr. Sherman?
Yes.
Children and Youth Services respectfully request the Commissioners approve a MOU with the Washington County Court of Common Pleas for the provision of the JOBS program for the period of July 1st, 2025 through June 30th of 2026 in the amount of $340,400, and no additional county funds are required.
So moved.
Second.
Roll call, please.
Mr. Maggi?
Yes.
Ms. Janice?
Yes.
Mr. Sherman?
Yes.
Children and Youth Services respectfully request the Commissioners approve a MOU with the Washington County Court of Common Pleas for the provision of the LEADER program for the period of July 1st, 2025 through June 30th of 2026 in the amount of $971,696, and no additional county funds are required.
So moved.
Roll call, please.
Mr. Maggi?
Yes.
Ms. Janice?
Yes.
Mr. Sherman?
Children and Youth Services respectfully request the Commissioners approve the recommended provider agreements for treatment, counseling, training, and other related services for the period of July 1st, 2025 through June 30th, 2026. The total contract authorization amount is $355,000, and no additional county funds are required.
So moved.
Second.
Roll call, please.
Mr. Maggi?
Yes.
Ms. Janice?
Yes.
Mr. Sherman?
Yes.
Children and Youth Services respectfully request the Commissioners approve a provider agreement with Cater to You Youth Haven to provide short-term emergency residential care for youth in crisis for the period of July 1st, 2025 through June 30th of 2026. The total contract authorization amount is $250,000, and no additional county funds are required.
So moved.
Second.
Roll call, please.
Mr. Maggi?
Yes.
Ms. Janice?
Yes.
Mr. Sherman?
Children and Youth Services respectfully request the Commissioners approve a MOU with the Washington County Correctional Facility for implementation of the Parenting Inside Out program for incarcerated parents for the period of November 20th, 2025 through November 20th, 2028, in the amount of $100,000, and no additional county funds are required.
So moved.
Second.
Roll call, please.
Mr. Maggi?
Yes.
Ms. Janice?
Yes.
Mr. Sherman?
Yes.
Children and Youth Services respectfully request the Commissioners approve a provider agreement addendum with Love to Care to provide an emergency children's residential facility for the period of July 1st, 2025 through June 30th of 2026. The contract authorization amount will be increased to $750,000, and no additional county funds are required.
So moved.
Second.
Roll call, please.
Mr. Maggi?
Yes.
Ms. Janice?
Yes.
Mr. Sherman?
Yes.
Behavioral Health and Developmental Services respectfully request the Commissioners approve a year-end contract adjustment with Aging Services of Washington County in the adjusted amount of $160,319 for the period of July 1st, 2024 through June 30th of 2025, and no additional county funds are required.
So moved.
Second.
Roll call, please.
Mr. Maggi?
Yes.
Ms. Janice?
Yes.
Mr. Sherman?
Yes.
Behavioral Health and Developmental Services respectfully request the Commissioners approve a provider agreement with Southwest Behavioral Health Management in the amount of $2,678,990 for administrative and complex care management services for the period of January 1st, 2026 through December 31st, 2027.
So moved.
Second.
Roll call, please.
Mr. Maggi?
Yes.
Ms. Janice?
Yes.
Mr. Sherman?
Yes.
Human Services respectfully
Mr.
request.
Chairman, if I could I ask if item number N could be due to passion, concerns, and basically some of what you said, that we're just looking at this, that we table this? And Commissioner Janice, you've not spoken on this. Where are you at? Are you,
I do not wish to table this now.
well, I make that not the motion, but a motion to table.
You're introducing a motion to table.
Table.
Is there a second on the table? Motion dies for lack of second. Chief Clerk.
Human Services respectfully request the Commissioners approve the submission of a letter of intent to the Department of Drug and Alcohol Program to retain and internally operate the single county authority designation.
So moved.
Second, roll call, please.
Mr. Maggi?
No.
Ms. Janice?
Yes.
Mr. Sherman?
Yes.
Purchasing.
What a shame.
Purchasing on behalf of the Planning Commission respectfully request the Commissioners authorize the advertising for proposals to design and build a miniature golf course at Mingo Creek County Park.
So moved.
Just a question, we know a cost, I know this is RFP, do we have any idea of what it's going to cost?
Don't you like miniature golf?
I like miniature golf.
Something for our
It's a
children,
great
too.
place to be, but
This is what we're asking. This is the request for proposal to see how much it will cost, engineering and design. Who will run it? No second. Second, roll call, please.
Mr. Maggi?
no.
Ms. Janice?
Yes.
Mr. Sherman?
Yes.
Purchasing on behalf of Aging Services respectfully request the Commissioners Approve an addendum to the lease agreement with the Bentleyville Public Library for the Bentleyville Senior Center to increase their monthly rent by $100, effective December 1st, 2025, bringing the total monthly rent to $850.
So moved.
Second.
Roll call, please.
Mr. Maggi?
Yes.
Ms. Janice?
Yes.
Mr. Sherman?
Yes. Thank you, Chief Clerk.
That's all I have. Thanks.
There are some duplicates on here, and the first one is Paulette Daniels. AC Roland and Cheryl, did you speak or do you want to speak
I
again?
want to speak again about what you just decided on.
Okay, fantastic. Paulette Davis. Sure.
Absolutely.
We'll make copies later.
I retired over 12 years ago, and I thought then that the amount of my pension was low. Most departments in the county only work 32 and a half to 35 hours a day, which of course lowered our pays. Cost of living has skyrocketed in those 12 years. Cost of utilities, car insurance, house insurance, school taxes, and food. It doesn't cover much at all. The people working are getting higher salaries, keep up with inflation, but us retirees don't have that advantage. Commissioner Sherman, do you recall, I had a conversation with you about a cost of living raise to our pension. I told you that several people I know get cost of living raises in their pensions every year. You said you never heard of pensions getting raised. I didn't realize that our state did it either. Then I found in our retirement booklet that the state of Pennsylvania requires all 67 counties to meet at least once every 3 years to decide if they want to do it or not. You told me you were unaware at that time and asked who made up the retirement board. I told you the 3 commissioners, controller, and the treasurer. I'd like to see the minutes for the past 12 years of the retirement board meeting because it is open for the public to see. I found out almost every county around us has this meeting often. I won't say which county, but one of them has given cost of living raises to their pensioners 12 out of the 13 years, this past 13 years. They base it on the COLA. We never received one, but now you want to hit us even harder by adding a $500 deductible to our insurance. And then kicking in plus the $750 out-of-pocket expense. This is a huge increase considering we still make the low pensions from what we started with. People who retired in 2013 already got messed over by this county. We worked without a contract that year. A contract was settled in August. They said it would be retroactive from January. Well, I was employed with the county until the middle of June. I never got a check making up the difference. We should have been included in that because legally we were still employees of the county for those months. I called Human Resources and they said to take it up with the commissioners. I had a meeting with a commissioner. He said basically that it wasn't going to happen and that they don't have to honor the employees who retired that year. I would have gotten a lawyer, but that would have been more than what I would have got to check for the balance of it. After everyone who was hired by the county after 2004 does not get health insurance when they retire. And the rest of us who get our pension are dwindling every year. So that should save you a lot of money to keep up with our insurances. And I have a question. Have people who were hired after 2004 but since retired ever gotten a cost of living raise on their pensions? Thank you for listening.
Not even gonna answer your question.
HR director extraordinaire.
Good morning. I was a dedicated county employee for 35 years. I started my career in 1975 in the commissioner's office and retired 15 years ago as director of purchasing. None of the positions I held were very high paying, but we had great benefits, which was the main reason I stayed. I'm here to address the concerns that the 65 and older retirees have about the change in our insurance. I'm sure most of you This additional out-of-pocket expense doesn't seem like much. We are all on a fixed income, and this does present a financial burden for many of us. Also, it's creating a lot of stress in our retirees, as we are concerned about what might be next. We are at the age where we desperately need good, reliable insurance due to our health concerns. We are also the group that would have the smallest retirement checks as our salaries were so low. The retirement board is required to meet once every 3 years to discuss cost of living increase for retirees. The last cost of living increase was 1998. The health insurance was to be a replacement of that. In 2018, the Board of Commissioners approved the transfer of funds from the general fund to an account covering other post-employee benefits trust. It is public knowledge that as of June 30, 2025, the market value of the OPEB trust fund is worth $30.3 million and is to be used exclusively for the beneficiaries. The commissioners at that time stated that they could not legally cancel the health benefits outright, but the board stopped offering the benefits to those that were hired after April 1st, 2004. They also stated that the policy that was promised to those hired while it was in place remains in effect until the last person covered passes away. We are only asking that the current Board of Commissioners follow through on this promise and not break the covenant with its dedicated employees. We are requesting the board to please consider your decision in changing our insurance. Thank you.
Good morning. I'm Sandy Sabat from North Franklin, and I worked for the county from 1997 to 2017. And I stayed with the county because I felt dedicated to doing the job that I was doing for child care information services. We had a great staff, and I worked with a lot of good people, and we did things to help people, just like most of the people in this room today have expressed about the drug and alcohol program. One of the things that I wanted to emphasize is when we took these jobs, we were hired with a promise that we would have these benefits, that we would keep those benefits throughout our lifetime. I spoke with HR to find out there are 650 people currently receiving this insurance. And people are dying off, as you know. As we age, we just die off. That's the way it works. But I just wanted to make sure that you are aware that the loyal employees who stayed could have taken other jobs and made bigger salaries, but they liked what they were doing for the county and the people they served. The most of the people I'm referring to are all the ones in all the different offices that work with the public on a daily basis and do the kinds of things that a lot of other people out there just don't want to do. So I would ask that you reconsider this. First, you're doing the $500 increase for next year, and then is it going to be $1,000 the following year, and then just totally get rid of it? This isn't, you have an ethical and moral decision to make here, because this was a promise made to all employees who were hired before 2004. So I ask that you reconsider any future changes in this program and keep the benefits for all of us who put in our time and made a difference in Washington County. Thank you.
Do you have any more speaking on that topic about the retirees, so we don't mix?
We reserve our comments to after everyone's done speaking.
That's my question. If there were others speaking on behalf of the retirees, maybe they should come up.
I'm saying what you're saying, yeah, no, we're gonna just keep it in the order which people signed up. Thank you, AC.
First off, I'm going to address this right off the bat. Her laughing while these people are talking about their lives. respectfully ask for my time to be brought back. Thank you. Thank you.
Okay with the commissioners?
Thank you. So for decades, as these people have talked about, WDAC has been a cornerstone for our county's response to substance use and their disorders. It's built on trust, delivery, and care grounded in compassion, and maintain a proven track record of effective service. For you to just come in here and say, oh, well, nobody's job's going to get taken is ridiculous. The staff that provides at the WDAC have walked alongside these people in some of their darkest moments without fanfare, without political motives, and without the help and funding from any of you guys. So now this funding's here, and now it's become so deeply concerning to you now that these settlement dollars are on the table. You guys suddenly want to reclaim this whole of WDAC's staff. The shift doesn't appear to be about improving services or outcome. It appears to look like a power grab and one for money. It risks disturbing the systems that already work. It jeopardizes all the care that those who need the stability the most already have agreements with and relationships with. So to be clear, transparency, collaboration, and accountability are what's going to strengthen public trust, not these backroom decisions, not this rush process, not this letter to see. The public deserves and demands access to the taxpayer-funded report that evaluates how well these programs have been doing and have been serving our community. We deserve an open dialogue about how settlement funds will be used. And we deserve a commitment to involving the people that are actually out here doing the work for the past 20 years. This just isn't about budgets. It's a bureaucracy. It's about actual lives. Every dollar from the opioid settlement is supposed to help the people recover, find stability, and rebuild their futures, not to expand political control. I urge these commissioners to not send letter in. This is enough. Bring WDAC to the table as an equal partner and invest in what's already working, not dismantling it. We, the people of Washington County, are watching you guys, and we want to see leadership that puts public well-being before your politics. Thank you.
Cheryl, are you speaking again?
Good morning. You all know who I am. I'm Cheryl Andrews. I want to thank Commissioner Maggi for his honest remarks following my last public comment. Before any opioid settlement monies were released, I met with the commissioners twice. Both times WDAC, the agency responsible for this work, was pushed aside. These funds are not taxpayer dollars. They are settlement dollars paid by pharmaceutical companies for the harm they caused. Since 2022, roughly $5.5 million has been allocated in our own county, and none of that funding was directed to WDAC. The Pennsylvania Opioid Misuse and Addiction Abatement Trust was created by the Commonwealth Court in 2022 to invest and distribute these funds statewide. The Trust's 13 trustees have been clear. Single county authorities are the best practice partners for coordinating local distribution. So why is Washington County disregarding what the Trust names as best practice by refusing to fund Washington County's single county authority? As elected officials, the expectation is that decisions about opioid settlement spending strengthen the overall treatment and recovery infrastructure and serve the people that are most in crisis. Instead, we are seeing concerning patterns that suggest funds have been politicized. Several individuals with no opioid-related experience have received large funding awards. Some of these recipients have very clear political ties or personal relationships with Commissioner Sherman. In some cases, they have made contributions to his political campaign. Further, it's very unclear whether the awarded funding is actually being spent on programming that even relates to the opioid crisis at all. The public deserves better. The community deserves full transparency around opioid settlement funding, how decisions are made, who is selected, whether those selections align with the trust guidance and the needs of the county. What I'm asking for today is simple. One, bring opioid settlement spending back in line with the state-identified best practices. Two, ensure a transparent and accountable decision-making process that the public can trust. Three, engage and fund the Washington Drug and Alcohol Commission, the single county authority charged with the task of being the central coordinating partner for the work. Washington County residents and voters are counting on you, the commissioners, to steward these funds responsibly and with integrity. Thank you.
Yeah.
Cheryl, I appreciate your talking points, and I agree with them so much that we already do that. There is a board that was put together that vets these programs. You continuously talk about that we're not giving any money back to the service providers, but the biggest chunk of money that we've actually allocated has gone to Gateway Treatment Center to rehab and to do a lot more work that they were doing because of the work that we've done with them in the past. And there's actually representatives from Gateway here today. They weren't allowed to speak because they're not residents of Washington County. They wanted to come and speak on behalf of the work that we did for the opioid settlement money. Maybe you can talk to them afterwards. Just my own rules that handcuffs me in my situation here, but everything that you're asking for exists. There is full transparency. You can go online and see every single project that we funded. So you can shake your head no, but it's accurate that actually you can. And we can provide all the documentation of everything that has gotten funded thus far. Again, to make the argument that no money has gone to nonprofits, it's almost all gone to local nonprofits, with, again, the biggest chunk going to the people that do the most work for drug and alcohol in Washington County, which is Gateway Rehab Center, which have a.
Good luck with your election next year.
And that is a fact. You can see that they have it there. And again, they weren't allowed to speak today, but. So again, just wanted to say, the allegation that, that there's no transparency, you can see where the money is spent.
Well, if you see that, then you should need your letter. If you have all that documentation, Sherman, why do you need the letter of intent to see where more money could be spent for better, which you said prior to your vote?
I don't understand what that means, AC.
Who funds the clients to If I could make a statement since you did there, you brought it up. Who is on the board? I mean, I've not seen any of these. Who's on the board that makes the decision to give opioid money?
Our human service director.
Who's that?
Dr. Timiji.
Okay.
Tiffany in the office, our director of county administrations, and
That's Mr. Price.
right now it's a
It's a three-person. And we don't get to see any of these opioid until we come down here to vote on them. So I do question the transparency.
You're invited to the meetings.
I am not.
You are invited. We're all invited to the meetings.
I am not invited to.
Yes, you are now there.
All right, next one is Laura. Laura Dito.
Hi, I'm Laura Dieterle, and I'm the Director of Clinical and Case Management Services at Washington Drug and Alcohol. I've had the privilege of being at WDAC for almost 12 years, and I've worked in just about every department within the agency. This experience has given me a unique front-row view to the impact our work has on individuals, families, and our community. Over the years, I've witnessed countless examples of lives changed and lives saved because of the services that we provide. One of the unique developments has been the creation of our Children and Youth Services Referral Program, which directly connects parents and caregivers to treatment and support. By removing barriers and streamlining access to care, we're giving families a better chance of recovery and helping keep children safe, stable, and families together when possible. WDAC work for children and families affected by substance use disorder is vitally important to Washington County. WDAC also uniquely serves adults in crisis. We have case managers integrated in Washington Hospital and Penn Highlands Mon Valley Hospital, to meet people exactly where they are during one of the most critical moments of their lives. Instead of handing someone a list of numbers to call, we connect people in need of support and treatment on the spot. We help them take the first step toward recovery before they even leave the hospital. These direct, personal interventions save lives every single day. But I want to be clear, the progress we made, the lives we've touched, depend on continued support and funding. When WDAC is not funded, the community feels the impact. People lose access to critical care. Families lose the support they need. Hospitals lose partners that help reduce overdoses and improve health outcomes for patients. And individuals facing addiction lose helping hands that guide them towards safety and stability. This is why access to opioid settlement funds is so critical. These funds were created to support exactly the kind of work we are doing: prevention, treatment, recovery, and community stabilization. Having access to opioid settlement funds would help ensure that WDAC can continue offering these essential services and without interruption. And you, our county commissioners, are in the position to make that happen. Your decision on how opioid settlement funds are allocated directly shapes the future of these life-saving programs and the lives of people served. I have seen firsthand what happens when we invest in people, and I've seen the consequences when resources are taken away. I'm asking you, commissioners, to recognize the value of our work and to allocate opioid settlement funding to WDAC, not just for those we serve directly, but for our entire community.
Yeah.
Thank you, Ron. Jordan Nutter.
Good morning, everyone.
Morning.
My name is Jordan Nutter, and I'm here as a lifelong 30-year resident of Washington County. I'm here to speak in strong support of allocating opioid settlement funds to the Washington Drug and Alcohol Commission, an organization that has been a constant source of hope, stability, and advocacy for our community. I have lived and built my life in Washington. I'm a proud Trinity graduate. I worked my first job at Bob Evans. I spent years managing the GameStop in the mall. I earned my associate's degree at Penn Commercial. I worked for almost 5 years as a staff member at W&J College before finally joining WDAC as their computer specialist. Washington is my home, and I love living here. But throughout my journey, substance use disorder has been a shadow over this beautiful community and the lives of those around me. I've seen coworkers fighting to stay sober, classmates whose futures changed overnight, and families trying to hold themselves together through unimaginable loss. It has been clear that this crisis isn't confined to one neighborhood or one demographic. It is woven into the fabric of our community. Since their inception, WDAC has been there, not for profit, but for the people. They have been the steady, unglamorous, day in and day out force doing the work that keeps people alive. They educate our youth, connect our neighbors with treatment, and advocate for the people who otherwise would have no voice. They don't just show up when there's attention or funding. They show up because the people of our county need them. In a time when the community is openly questioning leadership, demanding transparency, and asking for decisions that reflect the needs of residents, this is one place where the path forward should be obvious. Whatever disagreements or political tensions exist right now, this crisis is not political. It's human, it's local, and frankly, it's urgent. The opioid settlement dollars were meant for exactly this purpose: to save lives, to expand treatment, and to support proven community-centered programs. And with your support, WDAC can continue doing this work at the scale it needs. Unlike facilities that operate as a business first, where treatment can be shaped by billing cycles, profits, or quotas, WDAC stands apart as a nonprofit whose purpose is simple: help as many people as possible for as long as it takes, regardless of their ability to pay. Decisions are never shaped by revenue, they are shaped by the mission, with every dollar going back into prevention, treatment, education, and advocacy. The people we serve are never treated as billable units. They are treated as our friends and as our neighbors. WDAC is an organization that has earned the trust of this community, not with words, but with years of tangible results. I and my neighbors, the voters of this county who give you your power, strongly urge you to allocate opioid settlement funding to WDAC so these dollars can be used exactly as they were intended, to fight this epidemic, to help our residents, and to make this a safer, more beautiful community for our children and future generations to come. Thank you for your time.
forward. Shanna Wood.
Good morning, everybody. My name is Sheena, and I'm a person in long-term recovery. My recovery began August 4th, 2014. Just over 6 months later, on February 20th, 2015, my husband began his recovery journey as well. He walked into the Washington health system and met a compassionate social worker who's also served on the Washington Drug and Alcohol Commission's board. She did not see him as an addict or a problem. She saw him as a person worth saving. That moment changed our lives forever. And today I'm honored to do the same work as an embedded case manager with Washington Drug and Alcohol, serving individuals in the hospital at their most vulnerable. Recovery has shaped every part of my life. It brought stability to my family, it guides my work, and in April of 2014, it also broke my heart. On April 24th, my birthday, we learned that my father-in-law had died of an overdose. He lived in a county without the critical services we have here in Washington County. Because those services were not there, he did not get the support my husband and I did. The loss reminds me every day of why I do this work and why it matters, and why strong, stable local services are not optional, they're life-saving. I began at WDAC as a certified recovery specialist, working alongside one of our case managers at the Washington Hospital in the Mon Valley Hospital. Today, I am that case manager, meeting people in their hardest moments when they feel hopeless, ashamed, and completely alone. When I share that I'm in recovery myself, something shifts. They see that recovery is possible and real. I chose to recover out loud so those who are frightened and uncertain know they do not have to walk this path alone. Speaking openly keeps me grounded, humbled, and connected to the work I do. Program funding makes this work possible. It allows us to bring things that did not exist years ago, such as the WDAC Recovery Center. When I was in early recovery, my own family didn't let me come home at first. Having a safe, supportive place like that would have been life-changing, especially around the holidays when relapse rates are at their worst. These programs do not save lives, they rebuild them. One of my first clients just celebrated 8 years of sobriety on November 17th, 2025. When she came to me, her daughter was in foster care in Florida. Today, she has full custody. She started her own business. She bought a home. She is thriving, and she credits that to WDAC, giving her the support she needed to rebuild her life. That is what funding for WDAC work creates. Not just recovery, but reunifying families, restoring dignity, and community members who give back. The opioid settlement funds that you control are not just dollars. They are opportunities, they are second chances. And for many people, they are the difference between life and death. Please consider using opioid settlement funds to support WDAC in our efforts to give a second chance and life-saving assistance to those who need it.
Harry Giro? Harry Greco? Speak on retirement.
I didn't ask to speak, I'm sorry.
Oh, you thought you were just signing in?
Yeah, I thought I was signing
Okay. Sorry to call you out then. Mayor Jojo Burris.
Mr. Chairman, Commissioner Maggi, Commissioner Janice, I appreciate the opportunity to be able to speak in front of you all today. I've been on the wrong list and I'm happy I didn't. No, really. I was here to speak on the agenda list for the WDAC. But I'm glad I waited to do this during public comments because while I am the mayor of the city of Washington, I am somebody that is very active in the recovery community because I have a child that lives in it. And I've been in that community for 14 years. A lot of times we make decisions and we don't have a face to put with that decision that we're making. One thing that I'm going to ask you as commissioners to do as you go through your so-called study, which I know how to phrase it and to say whatever we need to make it look like we're doing the right thing. I need you to put a face with what's going on right now. Because of organizations like this organization, my child is still here today, and I can talk to her. However, there are some that slipped through the cracks because my best friend I grew up for 50 years with buried his daughter because she was fighting that battle. To create an unstable situation like we're going to do here now is just pure, excuse my language, dereliction of duty. We are putting families at risk. I have this conversation with my daughter all the time whenever she was in her active addiction. I am just waiting for the call for them to tell them that you're no longer here with me. What you guys are doing now, to hear today that this organization has got no opioid settlement money is ludicrous. Yep. Especially whenever we've seen the list and seen some of the people that are on that list. For that organization to not be on that list is a clear misjustice and injustice to the people that are in this community fighting for the rest of their lives every day. And here's the problem. Too many times we put ourselves on that pedestal and we sit down and look at these people as they're beneath us. So again, I'm going to ask you guys to just make this decision for whatever reason you want to put out there or whatever the real reason is. Put yourself in my shoes. Wait for that call from someone that says that your child is no longer here. Put yourself in my friend's shoes to get that call that your child didn't make it. You know, we all live in these porcelain worlds that are so perfect. But guess what? As the gentleman said that was up here earlier before, it has no color, it has no political affiliation, it has no age, it has no sex, it has nothing. You need to come up off of your high horse and put it into your, excuse me for running over my time, I'm going to say it with this. Put yourself in our shoes when you make this decision. Make sure that you're doing a decision for the right reasons and that you're representing the people of this county properly. Right. And again, thank you.
Good afternoon, all. My name is Brianne Pugh, and I appreciate the opportunity to speak today. I have worked at the Washington Drug and Alcohol Commission since August 2015. In the last 10 years, I have watched thousands of lives change for the better because of the services offered by WDAC. It is difficult to summarize the positive impact that I have witnessed over the years in just 3 minutes. When I began my work here, WDAC had 25 employees. Today, we have 40 staff members who serve in many areas of the county. We work with the legal system, hospitals, schools, children and youth services, senior centers, and many others. In my own role, I support community members in moments of medical crisis and help provide the tools that save lives. WDAC also has longstanding partnerships with local ambulance and care providers so community members can respond quickly when every second matters. Our services have grown because the needs of Washington County have grown. The coordination we provide across systems, providers, and families saves lives every day. Some of the services I mentioned are now being duplicated by recipients of opioid settlement funds and by the Department of Human Services. WDAC has been doing this work for decades. We know this community and we see every person affected by substance use as an individual. I've often been the first point of contact for someone trying to take the first step toward recovery. I have spoken with people from every walk of life: pilots, healthcare workers, teachers, attorneys, restaurant workers, and grocery clerks. Substance use disorder does not discriminate. It affects people regardless of income, race, ethnicity, religion, sexual orientation, or gender. I've also talked with people whose substance use began after being prescribed opioid medication and who later found themselves cut off from the same medication. These are the very individuals these opioid settlement funds were intended for. Washington Drug and Alcohol Commission is the only single
single county authority in Pennsylvania that has not been awarded opioid settlement funds. I am asking you, the Washington County Commissioners, to direct a portion of these funds to WDAC. This funding is essential to the work we do. By choosing not to fund WDAC, the only entity in Washington County that can send underinsured individuals to treatment, a significant gap in care is left behind. Thank you for your time.
What about your own DWIs? Were they squashed by the DA?
Good question. Solicitor report.
Commissioners, I don't have anything to add to my November report. There are no tax refunds to consider.
Thank you. Announcements, Chief Clerk.
Today's salary board meeting has been canceled, but the retirement board will follow this meeting. The next regularly scheduled Board of Commissioners meeting will take place in this room at 10 a.m. on Thursday, December 4th, 2025, followed by salary board. All county offices will be closed on November 27th and 28th in observance of Thanksgiving. The Board of Commissioners would like to wish everyone a happy Thanksgiving.
Thank you, Chief Clerk. There be no more business to be brought before this board. We stand adjourned. Thank you.